In top health news today, your healthcare is getting better. How? With artificial intelligence. Dr. Greg Sorensen is here from DeepHealth, and he's going to tell us more. And first of all, doctor, why don't you explain what is DeepHealth?
DeepHealth is the name of an artificial intelligence company that I co-founded a few years ago that's focusing on bringing these new advances in machine learning and deep learning, it's called, artificial intelligence to healthcare. Our goal, simply put, is to try to bring the very best doctor in the world to every single patient through the use of AI.
Okay, how will artificial intelligence benefit patients?
Well, artificial intelligence is really good at analyzing images and finding abnormalities very reliably. Reading medical images can be hard, and it can be very hard when they're subtle. And let me give you an example of how artificial intelligence actually can work in the case of X-ray mammograms, the yearly mammograms that my wife gets, my mom gets, and that some of your viewers may get. So, for example, here on my screen, I'm showing you what is a picture of a mammogram on the right. And this mammogram actually has a cancer in it. And a doctor found the cancer in it. And in this case, so did the AI. And this is the red box is what the AI labeled. And in fact, this was also what the physician found. And this woman was then brought back, a biopsy was obtained, and we found that this was cancer, and she was successfully treated. However, we've also taken this same woman's mammograms and showed the mammograms from 1 year earlier when the doctor didn't see anything. And this image on the left is that same woman, but her mammogram 13 months sooner when she'd come for her routine. And in this case, when we show the artificial intelligence, that same mammogram, it finds the cancer that the earlier interpreters didn't see. This is the kind of thing that we think that artificial intelligence is going to be able to do. Our technology has shown this. Other groups have shown that in many cases, we actually think we can start to see the cancer a year or maybe in some cases, even 2 years earlier. So we're very
That
excited
is,
about this.
it really is amazing. How are you incorporating this artificial intelligence into clinics at Arizona Diagnostic Radiology?
At Arizona Diagnostic Radiology, we've already started a program, even before this technology is fully rolled out, where we're using this as kind of a safety net or a backup for the interpreter. Let me give you an example. This is a mammogram, again, of a 57-year-old woman. This mammogram was originally read as negative by a very good radiologist. And we sent it to the AI, and the AI raised a little flag, this little box that you can see down on the left. This it turned out to be a cancer just on the edge of the film. And we humans often have a kind of a blind spot when it comes to edges, but the AI doesn't. And we've now started rolling this technology out at Arizona Diagnostic Radiology, and it's been very well received. And the idea here is to help find those cancers more reliably and earlier.
Now let's talk about too how this medical imaging is just changing the face of healthcare.
Well, look, the artificial intelligence, just like it can recognize your voice with your phone or find images in your pictures, it's also now reliably being used to analyze medical data. And as I've shown you some examples, medical imaging data. And at Arizona Diagnostic Radiology, we are already bringing the mammography tools. And DeepHealth has now acquired two other companies from Europe, one called Aidence and one called Quantib, that do lung cancer technology, just like I've showed you for breast cancer, they do for lung cancer, and also for prostate cancer. And so we hope that the tools that we're bringing will change many forms of cancer screening and all across medicine to try to improve people's health while also lowering costs.
Yeah, very fascinating. Thanks so much for sharing that with us today. And everyone, if you want to learn more about this, all you have to do is go to ArizonaDiagnosticRadiology.com.